Rapid review on classic presentation and its diagnosis. Number 1, gout, intellectual disability, self-mutilating behavior in a boy. Diagnosis is Lesch-Nyhan syndrome, HGPRT deficiency, X-linked recessive. Next, situs inversus, chronic sinusitis, bronchiectasis, infertility. Diagnosis Cartagener syndrome, Dynein arm defect affecting cilia. Next, blue sclera, diagnosis osteogenesis imperfecta, type 1 collagen defect. Elastic skin hypermobility of joints, increased bleeding tendency. Diagnosis Ehlers-Danlos syndrome, type 5 collagen defect, type 3 collagen defect seen in vascular subtype of Ehlers-Danlos. Arachnodactyly, lens dislocation upward, aortic dissection, hyperflexibility joints, Marfan syndrome. This is fibrillin defect. Next, cafe au lait spots, unilateral, polyostotic fibrous dysplasia, precocious puberty, multiple endocrine abnormalities. Diagnosis is McKeown-Albright syndrome, the GS protein activating mutation. Next, calf pseudohypertrophy. Diagnosis muscular dystrophy, most commonly Duchenne due to X-linked recessive frameshift mutation of dystrophin gene. Next, child uses arms to stand up from squat. Diagnosis Duchenne muscular dystrophy, that is called Gower's sign. Next, low progressive muscle weakness in boys. Diagnosis Becker muscular dystrophy, X-linked non-frameshift deletion in dystrophin, less severe than Duchenne. Next, infant with cleft lip or palate, microcephaly or holonprosencephaly, polydactyly, cutis aplasia. Diagnosis Patau syndrome, trisomy 13. Next, infant with microcephaly, rocker bottom feet, clenched hands, and structural heart defect. Edwards syndrome, trisomy 18. Next, single palmar crease, Down syndrome. Next, dilated cardiomyopathy, edema, alcoholism or malnutrition. Wet beriberi, thiamine deficiency, that is vitamin B1. Next, dermatitis, dementia, diarrhea. Answer, pellagra, niacin deficiency, vitamin B3. Next, swollen gums, mucosal bleeding, poor wound healing, petechiae. Answer, scurvy, vitamin C deficiency, can't hydroxylate proline, lysine for collagen synthesis. Next, chronic exercise intolerance with myalgia, fatigue, painful cramps, myoglobinuria. Answer, McArdle disease, skeletal muscle glycogen phosphorylase deficiency. Next, infant with hypoglycemia, hepatomegaly. Answer, Cori disease, debranching enzyme deficiency, or von Gerkes disease, glucose 6-phosphatase deficiency, more severe. Gerkes disease is more severe. Next, myopathy, infantile hypertrophic cardiomyopathy, exercise intolerance. Answer, Pompe disease, lysosomal alpha 1,4 glucosidase deficiency. Next, cherry red spots on macula. Answer, Tay-Sachs or Niemann-Pick. For Tay-Sachs, ganglioside accumulation. For Niemann-Pick, sphingomyelin accumulation. Central retinal artery occlusion. Next, hepatosplenomegaly, pancytopenia, osteoporosis, avascular necrosis of femoral head, bone crisis. Answer, Gaucher's disease, glucocerebrosidase deficiency. Next, Achilles tendon xanthoma. Answer, familial hypercholesterolemia, decrease in LDL receptor signaling. Next, anaphylaxis following blood transfusion, IgA deficiency. Next, male child, recurrent infections, no mature B cells, Broughton's disease, X-linked agammaglobulinemia. Next, recurrent cold, non-inflamed abscesses, eczema, high serum IgE, increased eosinophils. Answer, hyper IgE syndrome or Job syndrome, neutrophil chemotaxis abnormality. Next, strawberry tongue, scarlet fever or Kawasaki disease. Next, abdominal pain, diarrhea, leukocytosis, recent antibiotic use, Clostridium difficile infection. Next, back pain, fever, night sweats, Pott's disease, vertebral tuberculosis. Next, adrenal hemorrhage, hypotension, DIC, Waterhouse-Friderichsen syndrome, meningococcemia. Next, red currant jelly sputum in alcoholic or diabetic patients. Answer, Klebsiella pneumoniae, pneumonia. Next, large rash with bullseye appearance. Answer, erythema migrans from exodestic bite or Lyme's disease, Borrelia. Ulcerated genital lesion, non-painful, indurated is the chancre, primary syphilis caused by Treponema pallidum. If painful with exudate, that is chancroid. Haemophilus ducreyi is the cause. Next, pupil accumulates but doesn't react, neurosyphilis, Argyll-Robertson's pupil. Next, smooth, moist, painless, wart-like white lesion on genitals, condylomata lata, secondary syphilis. Next, fever, chills, headache, myalgia following antibiotic treatment for syphilis. Answer, Jarisch-Herxheimer reaction. That is rapid lysis of spirochetes results in endotoxin-like release. Next, dog or cat bite resulting in infection, Pasteurella multocida, that is cellulitis at inoculation site. Next, rash on palms and soles, Coxsackie A, or secondary syphilis, or Rocky Mountain spotted fever. Next, black eschar on face of patient with diabetic ketoacidosis, that is mucor or rhizopus fungal infection. Next, chorioretinitis, hydrocephalus, intracranial calcifications, that is congenital toxoplasmosis. Next, child with fever later develops red rash on face that spreads to body, that is erythema infectiosum or fifth disease, that is slapchicks appearance caused by parvovirus B19. Next, fever, cough, conjunctivitis, coryza, diffuse rash, that is measles. Next, small irregular red spots on buccal or lingual mucosa with blue-white centers, that is called Koplik spots or measles, that is rubiola virus. Next, bounding pulses, wide pulse pressure, diastolic heart murmur, head bobbing. That is aortic regurgitation. Next, systolic ejection murmur, crescendo decrescendo. That is aortic stenosis. Next, continuous machine-like heart murmur. Answer PDA, patent ductus arteriosus, close with indomethacin, keep open with PGE analogs or prostaglandin E analog. Next, chest pain on exertion. Angina, stable with moderate exertion, unstable with minimal exertion or at rest. Next, chest pain with ST depression on ECG. Answer angina, negative troponins, or non-ST MI, positive troponins. Next, chest pain, pericardial effusion, fraction rub, persistent fever following myocardial infarction. Answer, Dressler syndrome. That is autoimmune-mediated post-MI, fibrinous pericarditis, 2 weeks to several months after acute episode. Next, painful raised red lesions on pads of fingers or toes. That is Osler nodes, infective endocarditis, immune complex deposition. Let's cut for part 2.